Tonight, we're facing a growing crisis that echoes the very real dangers of political neglect. The world's deadliest infectious disease, tuberculosis, which is completely curable if caught and treated, is on the rise again, both globally and right here in the United States. And it's spreading at a time when cuts to U.S. foreign aid, especially USAID, have slashed crucial funding for testing and treatment. Earlier today, the Trump administration announced plans to completely shut down USAID and fire the remaining employees by September. All remaining USAID functions will now operate inside the State Department, though it's not clear Trump can shut down an agency without congressional approval. The impact of this cannot be overstated. The World Health Organization said this month that American government money supported a quarter of global funding to fight tuberculosis at a total cost of $250 million annually, a rounding error in the U.S. budget. It's 0.03% of what we spent annually on defense. Without that funding, the World Health Organization reports that tuberculosis will resurge, endangering millions of lives. And let's not forget the memo from a top USAID whistleblower that was leaked to the New York Times earlier this month that said, quote, disruption to tuberculosis programs overseas will result in more patients arriving in the United States and a 30% increase in drug-resistant tuberculosis. Thanks to declining U.S. rates of tuberculosis in the last century, most Americans today have no idea the type of effects tuberculosis can have on the human body. Here's the gruesome prognosis from The Atlantic. Quote, some people die of TB when their lungs collapse or fill with fluid. For others, scarring leaves so little healthy lung tissue that breathing becomes impossible, or the infection spreads to the brain or the spinal column, or they suffer a sudden, uncontrollable hemorrhage. Lack of appetite and extreme abdominal pain can fuel weight loss so severe that it whittles away muscle and bone. For billions of people, TB is already a nightmare disease, both because the bacterium is unusually powerful and because world leaders have done a poor job of distributing cures. To help us understand, joining us now is Maria Smilios. She's the author of Black Angels, which uncovers the forgotten history of Black nurses in New York City during the early 20th century who helped find a cure for TB. Maria, thank you so much for joining us this evening. This Tuesday, I believe, was World Tuberculosis Day, and we are facing a resurgence of tuberculosis around the world. It used to be called consumption, and this book that you have talks about what Black nurses did when they stepped into the breach, when many white nurses in America just didn't want to deal with the disease. So let's start there. What kinds of things were people facing in our last major tuberculosis crises that we were having maybe 100 years ago?
Well, to start, what they were facing was, as that article described, a really gruesome illness with no cure and even more gruesome death. Tuberculosis stirred people's most potent fears. They were dying 1 in 3, and then by 1940, it was about 1 in 7. And, you know, the thing with tuberculosis is it's always been a disease of injustice, and I show that in my book. It always affects the most vulnerable and marginalized communities, you know, the poor, the unhoused, the incarcerated, the medically neglected, and that's all painted in this very gruesome landscape. In the pre-antibiotic days, you know, I paint that in my book. And these people had been stigmatized, and because many believe they are less deserving of decent care or any care at all. So to connect it with what's happening right now, without mincing any words, these cuts to USAID are an injustice globally and on the American people. And it's a myth to believe that a rise in TB abroad will not affect us here. TB doesn't have any borders. It's one of the most difficult diseases to catch early. It is slow growing. Most diagnoses happen between 3 and 6 months after someone gets infected. So that means they are contagious and they are spreading the disease. So it's essential to keep TB rates down here and abroad.
And one of the amazing things I really, really enjoyed this was very detailed. It's frightening. It's almost like a mystery in its own sort of way. Is many of the Black women that stepped into this breach to serve this disease, they were unknown. They weren't necessarily given the sort of respect for some of the innovations and things that they came for. Do we see similar problems now? Do we see that in how, say, first-line people fighting COVID were ignored, or the way that USAID is being cut? Are we seeing a repeat of mistakes of the past of marginalizing the marginalized who have come forward to fight this disease?
Oh, absolutely. I mean, health equity isn't just about patients. And I want to say that the patients in my book were probably, the incredible victims of xenophobia and blamed for a disease that wasn't their fault, because tuberculosis is a social disease and it's a disease of marginalized populations. But to get back to the nurses, the Black Angels in my book, it was a name given to them by the patients, are very similar to the nurses who took care of COVID patients. Caregiving labor has always been racialized and undervalued in America. And during the TB crisis in New York, after the white nurses walked up, it was the Black nurses who were called up to care for these patients, who were considered second-class citizens. And we continue to rely on women of color to bear the burden without proper recognition and support.
Maria Smelios, thank you so much. Your book is Black Angels, the untold story of nurses who helped cure tuberculosis. It is a fascinating book. I encourage everyone to check it out.